Human trafficking is a crime that entails compelled labor or commercial sex exploitation of an individual by the use of force, fraud, or coercion by the traffickers for the sole purpose of financial gain and profit, or some form of value exchange such as food, water, shelter, drugs. Human trafficking is a global problem. According to scholars and field practitioners, human trafficking trends result from many factors, including the globalization of the world economy and tectonic shifts in geopolitical and economic divides.
In 2017, the International Labour Organization released a report estimating there were 40.3 million victims of human trafficking worldwide, of which 24.9 million were victims of labor trafficking, identified in many sectors such as domestic work, construction, manufacturing, agriculture, and fishing industry. Armed conflicts, failed states, natural disasters, and climate change among the factors contributing to global economic migrations that in turn create a demographic of vulnerable people seeking employment, shelter, and pursuit of a more prosperous life in developed countries. Traffickers, which range from a single person, a legal, illegal agency organization, illicit networks to criminal gangs and cartels, identify these vulnerable people and falsely promise them lucrative jobs or educational opportunities in more prosperous countries, of which the United States is the most sought after, thus beginning the cycle of prolonged victimization, abuse, and exploitation. Human trafficking is a national problem.
And today I want to discuss an issue that relates to each of these challenges. It ought to concern every person because it is a debasement of our common humanity. It ought to concern every community because it tears at our social fabric. It ought to concern every business because it distorts markets. It ought to concern every nation because it endangers public health and fuels violence and organized crime. I'm talking about the injustice, the outrage of human trafficking, which must be called by its true name, modern slavery.
Not only do human trafficking activities grossly violate human rights and criminal justice and immigration laws, they also harm the American economy, in part through the creation of illegal labor markets. Per federal government estimates, human trafficking-related illegal labor markets generate annual profits of approximately $9.5 billion, which in turn supports other criminal activities including money laundering, drug trafficking, and human smuggling. Some federal government sources tasked with combating human trafficking estimate that between 14,500 to 17,500 foreign nationals are trafficked annually into the United States for forced labor and commercial sex exploitation. In addition, the Polaris National Human Trafficking Hotline, a nonprofit agency, reported over 8,000 human trafficking cases annually and identified almost 5,000 traffickers and over 1,000 trafficking businesses and over 10,000 human trafficking victims in 2017. However, conventional criminal justice state and federal data platforms show a contrast in known and documented trafficking cases. For example, in its 2018 annual report on human trafficking crimes, the FBI documented a total of 1,400 human trafficking cases, of which 104 were labor trafficking cases, whereas in 2018, the Department of Justice reported 526 trafficking criminal convictions, of which 501 were sex trafficking cases and 25 were labor trafficking cases. In my research, I focused on understanding the scope and nature of foreign-born labor trafficking by focusing on structural and systemic gaps and opportunities for local law enforcement to eradicate labor trafficking in Oregon through public policy reform. In Oregon, there have been 0 labor trafficking convictions at the state level and only 1 conviction at the federal level, raising critical questions. Does the absence of convictions imply the absence of labor trafficking crimes and victimization, Or is it indicative of much larger systemic issues and barriers to identification and data collection on trafficking? According to the U.S. State Department's 2018 Trafficking in Persons report, human trafficking takes place locally, in a favorite nail salon or restaurant, in a neighborhood home or popular hotel, on a city street or rural farm. In 2004, U.S. Department of Justice publicly tasked the over 17,000 municipal, county, and state law enforcement agencies responsible for carrying out routine policing functions of local communities to be the eyes and ears for recognizing, uncovering, and responding to circumstances that may appear to be a routine street crime, but may ultimately turn out to be a human trafficking case. It prompted my research focused on the following issues. Henry was 17 when he crossed the border illegally and arrived in Oregon at his uncle's house. The uncle promised Henry a well-paid job at a local farm so that Henry could support his parents and siblings back in Honduras. 2 weeks after his arrival to Oregon, Henry was forced to sell and run drugs for his uncle, coerced into criminal activity. During a drug stint, Henry was arrested by Portland police for felony drug charges. Police acted within their training and policy. Officers did not know that Henry was a victim of mental and physical abuse, that his uncle used folk beliefs in black magic to subject Henry to psychological abuse and control. In addition, Henry was menaced with a gun if he refused to obey his uncle's orders. Unfortunately, officers did not look beneath the surface at the time. They did not have any training on hidden signs of labor trafficking. Otherwise, police officers could have discovered a trafficking ring with additional victims from Honduras held captives at an apartment. Instead of being identified as a victim of exploitation, Henry was categorized as a criminal, a felon. It took Henry 10 years to report his victimization and access victim services. Henry's trafficker was never arrested or charged with the crime of labor trafficking. No justice was served. This serves as one of many examples where the lack of training on labor trafficking and identification of marginalized trafficking victims results in first responders missing important elements of what are seemingly routine criminal cases, and more importantly, missing opportunity for rescue of victims and disruption of labor trafficking. Labor trafficking is exceptionally complex in nature due to the hidden aspects of illicit operations, cultural and systemic barriers, and the highly transitory nature of these crimes, often multi-jurisdictional, which spans across several states and even countries.
Meena is a widow with 2 underage daughters who at the time was living in Kathmandu, Nepal, working as a nurse assistant at a local hospital where she met an elderly woman. The American woman was a patient at the hospital, and Meena was taking care of her. It was there that the woman approached Meena and invited her to come to Oregon, where she was offered a $1,500 a month job to be the elderly woman's caretaker for about 6 months. Meena was promised a well-paid job and a unique opportunity to earn additional income to fund her daughter's education.
We arrived in Seattle, where the woman's daughter came to pick us up, and then we drove to Portland. They treated me well for first 2 weeks. They told me, "This is not your country. This is not Nepal. This is America. You have no rights in this country." They used to lock me inside the house when they were not home, as I wasn't allowed to go outside. They told me if I went outside, police would arrest me and take me to jail. I was so afraid of going to jail.
When Meena eventually escaped and with the help of local community members attempted to report her situation to the local police, officers told Meena her case did not rise to the criminal matter. It was a civil issue and referred her to the state labor department. Had officers had proper training on labor trafficking red flags, they might have found it that Meena was a victim of immigration fraud, her passport taken away by traffickers, and that she was a victim of physical and psychological abuse and coercion. It took several years before Mina disclosed her testimony to a police investigator. Her traffickers were never charged. They escaped justice. The federal law enforcement partners subsequently identified that Mina's traffickers attempted to bring another victim from Nepal. After all, human trafficking is a low-risk, high-profit criminal activity. How do local police officers disrupt labor trafficking, identify and intervene to rescue victims and hold traffickers accountable? Suppose local police officers and other first responders are best positioned to encounter and identify trafficking victims. What legislative frameworks are in place to foster a collaborative response and guide law enforcement agencies to identify trafficking victims? What institutional structures, policies, and procedures have to be in place to foster victim-centric response and promote multidisciplinary collaboration? As a police officer, I've been conducting labor trafficking criminal investigative interviews for the last 8 years, which allowed me to integrate some of the labor trafficking cases into my thesis research. My trafficking case studies confirmed what leading national trafficking scholars Amy Farrell and Colleen Owens have concluded. To better understand gaps and opportunities in identifying and documenting labor trafficking, I did a comparative analysis of the evolution of the criminal justice system's response to domestic violence and child abuse crimes in Oregon. I examined how the enactment of mandatory reporting laws and policies contributed to justice reforms and impacted local law enforcement agencies to require the collection and sharing of reported data, resulting in significant institutional change in addressing domestic violence and child abuse. Prior to the enactment of mandatory reporting laws in the late 1960s, early 70s, police officers responding to reports of domestic violence had professional discretion on whether to document incidents of abuse. Research shows that many police departments had hands-off policies when responding to domestic violence. Unless victims sustained severe physical injuries, police rarely arrested domestic abusers or documented misdemeanor domestic violence crimes such as harassment, strangulation, or physical assaults, resulting in cuts, bruises, and the like. In 1979, a victim of domestic abuse testified before Oregon Senate advocating for mandatory reporting legislative change. In her testimony, she stated, "In a fit of anger, he threw a hunting knife at me. It flew past my head and past the head of my son, who was sitting on the bed. He threw it so hard that it buried itself into the wall to the handle. Again, the police told me, 'Sorry, it's a family dispute, and he didn't actually hurt you.'" If this incident was reported today, the suspect would have been charged with multiple felony person crimes and the victim connected to proper services and protection. As a result of decades-long advocacy by crime victim groups and the medical community, the complex issues of child abuse and domestic violence were no longer a family matter, hidden from the public eye. Instead, it became a collective responsibility to report and intervene in order to protect the most vulnerable victims. My research highlighted that, very much like domestic violence and child abuse victims, foreign-born human trafficking victims rarely self-identify and self-report as victims of crime, experience emotional and financial dependency on their abusers, traffickers, suffer from shame and guilt, experience isolation, suffer from a prolonged cycle of mental, physical, sexual, and psychological abuse that can last several years and even decades, fear the police interpretation, face language and cultural barriers, do not know they have rights to protection and assistance. First responders are very likely to encounter foreign-born human trafficking victims in the course of their duties. Mandatory reporting requirements on the victimization of the most vulnerable demographic, children, elderly, disabled, and women, over time resulted in enhanced investigative policies and procedures, analysis of the incidents, breakdowns on victim-offender demographics, types of weapons, etc. Implementation of state-mandated training and education of law enforcement on the typology of abuse, reporting barriers, trauma-informed investigations. In essence, mandatory reporting caused a cultural shift within police agencies and removed cultural barriers to understanding family violence. Consequently, such matters are no longer regarded as private family issues, but as criminal acts and criminal justice, public health, and human rights cases. Labor trafficking is a national problem, a concern to national security and homeland security enterprise as such, be it from the immigration lens, criminal justice lens, civil and human rights, or public health. Moreover, labor trafficking intersects many homeland security sectors and professions, thus placing many homeland security stakeholders such as first responders, healthcare professionals, DHS employees, immigration attorneys, federal law enforcement, private sector, and many others in the best position to identify and disrupt illicit trafficking activities. My research highlighted that in Oregon, there are no existing trafficking data platform of agencies tasked with combating labor trafficking, and found out that despite best efforts and resource allocation, labor trafficking data is fragmented and inconclusive, lacking in sustainable intelligence infrastructure for sharing, analysis, and further assessment of labor trafficking trends and emerging threats. My research also highlighted that first responders, police, fire, and medical professionals are often unaware of labor trafficking issues and thus misidentify victims.
In my thesis, I argued that based on intersectionality and similarities in the arena of victim typologies and historical, structural, and institutional barriers and limitations to victim identification, amending the existing mandatory reporting laws and including a category of yet another vulnerable victim category, human trafficking, would improve detection and disruption of illicit human trafficking activities. Like in the case of domestic violence and child abuse, such legislative change would prompt agencies to collect labor trafficking data and reports. Such reports, data collection and analysis would help policymakers and field practitioners identify gaps in prevention and response programs, supporting further research for policy improvement and recommendations for statewide programs and stakeholders. Improved data collection systems allow for a more informed, evidence-based, and culturally responsive and tailored policy response. Unfortunately, such systems are not currently in place for the labor trafficking issue. This research recognizes that amending mandatory reporting laws requires direct involvement of trafficking victims and survivors to ensure that such legislative efforts are ethical and do not unintentionally cause harm to victims and the rescue process.